Continue informing you. The Glazer Pediatric AIDS Foundation has launched a modern equipment to fight communicable diseases. The foundation has been offering free medical services in Central Region. The Elizabeth Glazer Pediatric Foundation, in partnership with the Ministry of Health, has released a report on its pilot free medical aid to residents in the larger Central Region. In a function graced by Acting Director General of Health, Dr. Patrick Amoth, the foundation's country director, Dr. Eliud Mwangi, has lauded the ultra-modern medical equipment that greatly helped to deal with the COVID-19 pandemic, and which he hopes will be replicated in the entire country to help disadvantaged population deal with the major communicable diseases like COVID.
As our teacher is indeed also to appreciate and...
One other advantage of this project, of course, is the significant investments that have been made in diagnostics, therapeutics, and evidence generation for policy making, which is critical. In this era, every decision that governments make will face serious critique. One, to be able to ensure that the science-based are in sync with modern practices. So any intervention that generates evidence for policy formulation then is critical, because then the policies that are made out of that intervention then is based by science and therefore can be supported and embraced by all.
We integrated the COVID-19 testing and also management in the outpatient, in maternal and neonatal child health clinic, in the TB clinic, in the non-communicable disease clinic, and also right in the community. This is so key because this is the only sustainable way, because it's not possible to have different systems or different structures for every disease. And therefore we thought the best way is really to integrate these services for COVID-19, and it has worked so well through the collaboration and partnership with Kiambu County, and also working with the Ministry of Health, even at the national level. This project also supported the wonder drug, which is tocilizumab, which at the height of COVID was costing 300,000 shillings. And you can imagine how much is that and how many people can afford it in the country. And we were able to avail, or we have been able to avail this treatment in the entire country.
We have really utilized our primary healthcare networks because we are using the community health volunteers to screen and to test these patients or these people at the community level. So it has also helped us as a county to integrate primary healthcare into our system and to accelerate it.
But for complex treatments and needed to be made available to the public. So working with other groups, working with the innovators, working to cut the costs that typically are involved with distribution of fairly expensive medicines, ensured that donors could afford the test, could afford the technologies, the medicines in this particular case, so that it's not just a question of what the medicine used to cost before. It's about getting the cost to a level where the innovator can make money, can do business, but at the same time at an accessible price for governments and working with their partners.
Catholic faithfuls all over the world gathered in their churches for